सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून एंड गुड इवनिंग जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर ज्वाइनिंग आवर लाइव सेशन. माय नेम इज कुंजन मवार. हमें आपके होस्ट और दोस्त फॉर टुडेज एफबी लाइव सेशन. Indian origin folks living in US, if parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobal Doctors has your back. eGlobal Doctors have started a new diet consultation, nutrition, and health. No insurance is needed. Reach out for fast-growing eGlobal Doctors network. If you are living in US and your parents live in India, you can now consult doctors in USA. eGlobal Doctors have dedicated diet programs that includes Indian food. Yes, you heard it right. Now you can eat your favorite Indian food and diet at the same time. How cool is that? If you are struggling with diabetes, thyroid, or want to join a detox program, there are 3 different programs provided and available at eGlobalDoctors.com. Free diet consultation, 3 weeks program, 3 months program, along with dedicated coaches. Register today at eGlobalDoctors.com and book your appointment to get a proper nutrition coaching. In today's Facebook Live session and Insta Live session, we will be exploring and providing more information about breastfeeding with Dr. Maya Nambisan. Dr. Maya is a board-certified OBGYN with a master's degree in public health. She has a degree in literature from UC Berkeley and completed medical school from University of Illinois, received her master's degree in public health from Yale University. It's really nice to meet you again virtually, Dr. Maya. Thank you for sparing time and good morning to you.
Good morning, Kunjan. It's so great to see you again.
Thank you,
Thank
Dr.
you for
Maya.
inviting.
It's pleasure is all ours, and I hope you are doing well on a Saturday morning. So what do you say? Shall we dive into our today's topic?
Let's do it. Let's do it.
So if somebody is joining us right now, we want to tell you that we are live with Dr. Maya and we are live on Facebook and Instagram. So hop on your favorite social media. Interesting topic. If you are a new mom, then you should be listening to this live session right now. And Dr. Maya, so what are the benefits of breastfeeding? So when you tell me the benefits, and for our listeners and viewers, tell me the benefits for the new mommy and for the infant.
Absolutely. There's multifold benefits for both mom and infant. So starting with the baby, actually, just in the first few moments of life, part of the resuscitation of a newborn is thermal regulation, making sure that the baby deals well with the ambient temperatures outside of the womb. So to deal with that transition, skin to skin, snuggling, putting the baby on the breast, just that action will help with resuscitative and transition from the womb to the outside environment. So it helps with bonding. It can really help with decreasing the risk of chronic diseases, particularly autoimmune diseases, diabetes, other autoimmune diseases. It can decrease the risk of allergy in babies, food allergies. It can mature the gut and decrease the risk of necrotizing enterocolitis in newborns, which is one of the risks of preterm birth. It can, it has multifold improvements in baby's IQ and learning afterwards. So there's so much for baby. For the mom, there's also increasing in bonding with the baby, so that can help. It also decreases the risk of breast and ovarian cancer, and it can decrease the risk of type 2 diabetes in women. Some women say that when they breastfeed, they can lose the weight from pregnancy quicker, so that's another added benefit. There's lots of different benefits.
I love that. So hopefully new mommies, if you are listening and if you have any doubt, hop onto your social media and ask the question. But you just heard that what are the benefits of breastfeeding. So I have heard, and again, you are the subject matter expert, so you can tell me if what I hear is correct or not. But people say there are different kind of stages in breastfeeding. So is this something true? And if it's true, then elaborate on different stages for us.
There are different stages to the breast milk when it's being produced. So it's really important for new moms not to get discouraged in the first 2 days after delivery, because sometimes colostrum, which is the early stage of breast milk, which is very, very important for the baby. It doesn't always get produced, day one, immediately postpartum. It can happen, it can sometimes take 2 to 3 days. And it does not resemble breast milk at all, what you would typically think of as breast milk. It's yellowish, it's thicker. It's produced only in ounces, 1 to 2 ounces, at a time. Very little of it is produced, but it's all the nourishment that a newborn needs. And it's packed full of antioxidants, immunoglobulins. So it's really a superfood for baby. And then a couple days later, then you get this transitional mix. It is a mix of colostrum and mature breast milk. And it might be a little yellowish, a little thinner. And then finally, 3 or 4 days after that, so maybe even 1 to 2 weeks after you have delivered the baby, you can have the mature breast milk. Some women get discouraged. Many of my patients have gotten discouraged because when they attempt to express milk immediately after delivery, they don't see anything. And it's not abnormal for that to happen. And even so, you may be producing colostrum. You may not recognize what it is.
Understood. So, a follow-up question, like I've also heard that when the baby latches properly, it also helps in the production. So is that also true?
Yeah, so I think we're going to talk a little bit more later on about complications in breastfeeding, but the latch is very important. And, several generations ago, women would breastfeed together. It was a community activity. There would be mothers and grandmothers at the bedside and postpartum to help with latching the baby, but now women don't have those resources, so it's difficult. And babies, like their adult counterparts, they're all different. So some of them come out with the ability to latch perfectly, and some of them need a little help. So that's where training, reading, taking classes, having a lactation consultant at your bedside is very, very crucial. Because you're absolutely right, Kunjan. Yeah, I was going to follow up and say you're absolutely right. If a latch is not right, it can cause pain to the mother, so that can cause people to stop breastfeeding. And also it could decrease the chance that the baby's getting adequate nutrition.
Understood. Okay, thank you. So now that we have squared away that why it's important and what are different stages, let's talk about that we are in that 1 week or the second week, and the mature breast milk is on its way. So how many times in a day should a baby be fed?
Typically 8 to 12 times a day in the newborn period. At a minimum every 3 hours. That's a minimum. So sometimes, approximately every 4 to 6 weeks, the baby goes through a growth spurt, at which point the baby may cluster feed or nurse continuously. And that is not abnormal. It is completely normal and to be expected. And it's also necessary for the baby's growth. The other thing that's important to know is that some babies, as all babies are different, some babies want to stay on the breast for a bit longer because they need that comfort, because it's also a great comforting mechanism for them. So you must allow the baby to do that as well.
Okay, perfect. What are some cleanliness tips that one should know or one should follow to avoid any potential infections?
There's not a whole lot of hygiene regulations surrounding breastfeeding. There's not anything specific you should do. When you shower, making sure you clean the breast and the nipple in your shower like you would typically do. You don't need to do anything differently. Keeping the breast dry is very important so that you can minimize the chance of yeast infections, which sometimes get confused with infections of the duct of the breast and can cause pain and also can affect breastfeeding. So what a lot of lactation consultants recommend is taking breast milk, expressing a little breast milk after breastfeeding and rubbing it on the nipple. It can be a salve to the nipple, especially to a chafed nipple, and it can help to protect it. And then you just let it air dry. And that's all you really need to do. Wash in the shower and maybe use this breast milk. You don't need to do anything more.
Okay, perfect. Thank you so much. I'm sure people are listening to us and they will take these tips into consideration. So, we talked about the cleanliness and the cycle. When should a mother avoid breastfeeding? Are there any specification when we should not feed the baby?
Again, with this, there's very few absolute contraindications to breastfeeding. The major one would be a problem with the baby's metabolism called galactosemia intolerance. And they may not be able to break down the breast milk sugars properly. They may have a metabolic issue. So that would obviously be a danger to the baby. If the baby has any defects in the oral cavity, such as cleft palate, cleft lip, that might make it difficult. HIV, that's the number one and really the only infectious disease contraindication. Everything is relative. A lot of people have questions about alcohol use, for instance. Yes, it's not good to overindulge in alcohol, but if you have a glass of wine, waiting a couple of hours and then breastfeeding is perfectly safe. It won't affect the baby. The important thing to know is that most medications do get transmitted to some degree in the breast milk, but it's not dangerous to baby.
Okay, I was gonna ask, what about, if we are in pain and we take ibuprofen or over-the-counter medications,
That's
allergy
perfectly fine.
medications? Okay. So
Yes,
if you
yes, those
are
are all fine.
listening, okay, so if you are listening, there's a myth busted over-the-counter medication. It's perfectly fine. You can have a glass of wine and then wait a couple of hours and then do what's needed to be done. So thank you so much for that. So I just want to remind our viewers and listeners, if they are joining us right now, we are live to you both on Facebook and Instagram page. So hop on your social media and we bring to you every single week new topics, new interesting topics that educate you. So if you are joining us, we are in conversation with Dr. Maya about breastfeeding. So does breastfeeding during a child's vaccination period, does it help in pain management, because children do cry when the syringe go in. So any thoughts on that?
Absolutely. Like I said earlier, breastfeeding is a comfort mechanism for babies. Even those babies who don't, use the breast as a pacifier in a general manner can be comforted by being placed on the breast. Breast milk also is very important. It changes throughout the day. So in the evening time, there's an increase in tryptophan, which is a protein that encourages sleep. And so that can also be comforting to the baby. So it's important to know that not only breast milk itself, which does help, but also the proximity, the act of breastfeeding is comforting to the baby.
That's actually good to know. So no wonder if they latch in the evening, they never want to come out from there. So now it actually
Some of
makes
them don't.
sense.
Yeah.
Wonderful. Thank you. So what are we talked about the benefits. Now, if we have benefits, I'm sure there are some which are not too beneficial. So what are some common problems associated? I don't know if problem is the right word or not, but some issues which are associated with breastfeeding.
Yeah, so we talked about the latch earlier. The latch is very important. And, there's been a lot written on the correct latch. And anecdotally working with patients, I have to say, reading about it alone is just not enough. Some babies come out, they have a great latch, that's it, they're good to go. But working with a lactation consultant, working with a family member who has experience, that's priceless in being successful in breastfeeding, because a poor latch could be too shallow, meaning that the baby does not compress enough ducts and get enough breast milk out, but it could also be extremely chafing and painful. And that is a cause for many women stopping their breastfeeding. Another cause is infection. So we talked a little bit about yeast infections. Those are quite common. If the breasts are kept moist, you can get a yeast infection and then pass it back and forth between you and the baby. So in order to truly treat an infection like that, you have to treat the baby as well as treat mom. So keeping everything dry. Breast milk, mastitis, infection of the breast duct and tissues, that is not a cleanliness or hygiene issue. It is a problem with not expressing the milk enough. So if you don't fully express and empty the breast, then there can be a backup, and clogging the milk ducts that can be painful in and of itself, but you can also develop an infection on top of that. And that could be, a mild infection to a very serious, severe infection causing abscess, needing a hospital stay. So those are some common problems, but I would have to say anecdotally that the most common problem is expectation. People come out, they think either it's going to be a cinch, easy, I don't have to do anything, it's not a skill I have to develop, or they think it's too hard, it's going to be too painful. And it's neither, it's a kind of a go with the flow, listen to the baby, let the baby lead, which is, I believe, the key to everything in labor and delivery and the postpartum period. So instinctual rather than academic in some ways,
Thank you. Yeah, thank you for that. And that's a wonderful insight that they know what they want. So just, pay attention to the actions and the gestures because they can't talk, but they will let you know what they want. So thank you for that. So another questions like, are there any nutrients for feeding mothers that might help to generate more breast milk?
Oh, to generate more breast milk. Yes, there are some herbal remedies. Increasing, one of the main things I tell my patients is make sure that you're well hydrated, because breast milk is, made up of a lot of extra fluid. Hydration is very important. Drinking water is, as you did in pregnancy, 3 to 4 liters a day is recommended. There are teas, there are herbal supplements, there are home remedies. Many things have been recommended to stimulate breast milk production. I'm not going to go through the whole list right here. A mechanical way of stimulating more breast milk is simply either latching the baby more often, or if the latch is an issue, pumping. So I always tell my new patients and new mothers to have a pump on hand. It could be a manual pump, it could be an automatic pump, but pumping the breasts can increase breast milk production within 1 to 2 days to 1 to 2 weeks. Adding more pumping sessions, that's important. In terms of supplements for the breastfeeding mother's health, there really isn't anything special that the breastfeeding mother needs to take. I usually tell them to continue their prenatal vitamins. But if they have a balanced diet, there's nothing specific that they need to add to their diet.
Okay, wonderful. So there are some remedies. If you need more information, you know where to find Dr. Maya. So thank you for that. And continue with your nutrients and hydration. I think hydration is really the key. So thank you for elaborating on that. So my next question would be, how long is there a period that the baby should be fed breast milk? 6 months, 8 months, year, over a year? So elaborate on like that, on topic of that.
Well, the true answer is really whenever baby and mom, however long baby and mom want to continue, they should continue. WHO, World Health Organization, recommends 2 years. Our college recommends a year. 6 months is fantastic as well. The first 6 weeks, if you're able to breastfeed for just the first 6 weeks, you will be able to give the baby the immunoglobulins in the colostrum, the important nutrients from the breast that's really crucial to the baby's first few weeks of transition. So that's important too. But however long baby and mom want to breastfeed, however long they're happy doing it and contented, that's how long you should do it.
Okay, wonderful. So same thing, let the baby lead and the baby will tell you if they are wanting to continue or not. So can it be a mix? Can we have formula and the breast milk done together simultaneously at the same time?
You absolutely can, and there's no harm in doing so. I would say within the first few weeks, the 4 to 6 weeks of breastfeeding, if you want to continue breastfeeding as well, try not to introduce pacifiers or other nipples, bottles at that time, because the mechanism of getting milk out of the bottle is very different than getting it from the breast. And that might lead to what's commonly called nipple confusion. It might lead to the baby being unwilling to latch and breastfeed that way. So for the first 4 to 6 weeks, I encourage, breast only, but then afterwards it's perfectly fine and safe, and sometimes saves a mother's exhaustion and their mental status to have somebody else give a bottle. And that could be
Okay.
express breast milk or formula, no harm there.
Okay, perfect. So 4 to 6 weeks, stick to the old-fashioned way, but after that, you can mix and match, and it works fine. Okay. So how do we know that the baby is getting enough milk? Like there is no, is there a ratio? Like, do we have to measure something, or how do we know?
No, and that's the biggest, I think, stumbling block for new mothers, because they're so worried. They don't see how much the baby's getting. There's no measurement tool. So they're so worried that the baby's not getting enough. Especially sometimes when they pump, they don't see a lot as they pump, because the pump is an inefficient method compared to the baby of extracting milk from the breast. So they may see a totally different scenario between the breast pump and what the baby is getting. So a baby who is breastfeeding well is contented after the session, the breastfeeding session, and often stops the breastfeeding on their own. That's outside of times when the baby needs extra comfort, during those growth spurts, for instance. 3 to 4 poopy diapers a day, okay, that is another sign that the baby's getting enough. Note that the baby will not produce urine immediately. It'll be more the meconium and the yellowish seedy stools that you'll see initially after baby's born. So don't worry that you're not seeing the urine in the diaper immediately, but 3 to 4 poopy diapers of that seedy yellowish quality, that will give you an indicator. But a baby who's contented and satiated will not be irritable. I mean, just think how we all feel when we're hangry, right? We get angry. They'll sleep well. They'll wake up on time to nurse, and they won't be crying or want to stay on the breast too long.
Okay.
The other indication, there is one measurement tool, sorry, Kunjan, that the pediatricians might use, and that is checking weight loss. So within a week or two, within 2 weeks, the baby should have regained the birth weight, because babies lose a little bit of weight immediately after birth, and they should never fall between that 75th growth percentile. Okay.
Okay, yeah. So that's an indication, right? Because I think for the new mom, it's important if something is right, very clear. So I think that's a wonderful example, and do everything else that Dr. Maya told us. So that's, I'm sure, if we have someone who's new mommy and they are listening, they are getting a lot of help through this session, and they are getting educated. So you did touched upon pacifiers or bottles. So is it okay? Like, I understand not to give them or introduce something new for 4 to 6 weeks, but so I have 2 questions, but they are related to the bottles and pacifier. Usually when the child is crying, okay, put a pacifier in the mouth, give them the pacifier so it eases them up. But then I've also heard that they are also taking the air, which they don't need if they're not latching properly on the bottle. So shed some light on that.
Well, it's okay to use pacifiers once in a while. I wouldn't use it as a common tool to comfort your child, even after those 4 to 6 weeks have passed, because again, you and your baby, you're strangers to each other, even though you've carried the baby in your womb for 10 months. You want to make sure that you are listening to clues. So if the baby is constantly crying, and you fed the baby and it appears that the baby is satisfied after being breastfed and nothing else is calming the baby, you have to look into that further. A pacifier won't do enough. It'll just it won't solve the problem. In terms of it causing you to what did you say, swallow air? There are bottles that specifically minimize that, so you can, that's not really a huge concern for the bottle feeding mother. It's still possible to bottle feed your baby and not have that issue develop. Certain bottles are specifically made so that air is not swallowed routinely by the baby. I don't think that will get in the way as long as it's used judiciously. And I think that's the important component.
Okay, perfect. Thank you. I'm sure the new mommies are getting all the benefits, and the mommies whose kids are big enough, they are probably thinking, where were you, Dr. Maya, when I needed you? Thank you for that information. So let me check. I don't see any questions on our live chat. So if you are listening to us and if you have any question which has been bothering you or you want to ask for a friend, please ask your question. We are live to you on Facebook and Instagram. So I don't see any questions. So with that, Dr. Maya, it's a wrap. We really appreciate you coming on and educating us. So I just want to quickly tell about the benefits of health packages that eGlobal offers. They are introducing packaging deals for you and your family members. Now you can get yourself consulted at a lower cost. You can choose from their board certified doctors. Prescription will be provided. They have umpteen number of specialties. Please go visit eGlobalDoctors.com. Video consultation up to 30 minutes, and the package can be used by you or your family members. Like I mentioned in the beginning, eGlobalDoctors have started a new diet consultation, nutrition, and health. No insurance is needed, and reach out to fast growing doctors network. If you are living in US and your parents are living in India, you can consult a USA doctors. eGlobalDoctors have dedicated diet programs that includes Indian food. Yes, you heard it right. You can eat your favorite Indian food and diet at the same time. If you are struggling with diabetes, thyroid, or you want to join a detox program, there are 3 different programs: free diet consult, 3 weeks program, and 3 months program with dedicated coaches. Register today at eGlobalDoctors.com and book your appointment to get a proper nutrition coaching. So before I let you go, Dr. Maya, any word of wisdom you want to share with our viewers?
Yes, I want to tell breastfeeding mamas out there who would like to breastfeed for exclusively, that it is a skill, it's a learning situation. Get all the help you need, read up, buy your pumps beforehand, lower your expectations, take your cues from the baby. This is something that's not purely academic or objective. This is an interaction between you and a new human being. And you have to look for the subtle signs, the subtle clues. And it may not be easy. You may not see objective results of your success immediately, but that doesn't mean that it's not working. And any questions, go to your providers. Mm-hmm.
That's wonderful. I'm sure it will ease a lot of new mommies if they are listening, or if they go back to our recording and to listen. So please go with the flow and listen to the cues that the newborn is providing. So thank you so much. This is Kunjan signing off. See you guys. Stay safe. Keep smiling always until we see you again. Thank you and namaskar.